We're going to look at an exercise that I personally do as part of my own practice, but I also give to patients quite regularly. So we're going to start with our hands crossed. Open the chest. Close the chest. Open the chest. Close the chest. Open the chest. And close the chest. Back to center and down. While this exercise is fairly easy, there is some subtlety to it, so let's look at a couple key points. First off, when I'm working with people, I generally have them line the hands, elbow and shoulder up, and then as they continue to open, the hands get slightly ahead of the elbows. Pull the shoulder blades together, full opening. The reason I do that is if people are restricted in their shoulder motion, they're often staying in internal rotation and leading with the elbows. So the shoulders internally rotated, the chest remains closed, and I don't want that. I want them to go into more external rotation. So they find that alignment. As they continue to open, the hands get ahead of the elbows. That puts the shoulders in an externally rotated position and allows the chest to fully open. Then the chest softens, internal rotation, back to the center. So open, line the hands up, hands get slightly ahead, externally rotate. Not a big internal rotation here. First of all, the dropping of the chest gives me some room so that I can rotate comfortably. Sometimes people with shoulder problems, it hurts to internally rotate. This one's primarily pronation that's happening and slight movement in the chest. There is some internal rotation. You can restrict that and make that smaller if it causes pain. You want it to be comfortable. But the key is that I want the opening of the chest to change positions and close and give me space and room for that movement to occur. Up, line, hands, elbow, and shoulder up. Hands get slightly ahead. Pull the shoulder blades together. Compress. And back down. So the next aspect is to look at the shoulder protraction, which happens here. My elbows are not super close to my body. My elbows are slightly away from the body, which allows my shoulder blades to wrap around the rib cage. I don't want to be tense in the shoulders. Shoulders are relaxed and dropped, but they're protracted. That protraction then allows me to go into a full range of motion as I retract and pull the shoulder blades together. So it makes for a bigger movement. Compress, hands back and down, drop the shoulders, elbows forward, which takes my shoulders into protraction, open, retract. So the bigger shoulder blade motion I get, the more the connections of the shoulder blade to the rib cage and the shoulder blades to the spine create movements there. So things like the rhomboids and traps pull on the spine, serratus anterior, pec major pulls on the rib cage, pec minor pulls on the rib cage. So through those soft tissue connections, I get an expansion in the rib cage and a compression in the rib cage. Elbows forward, protract, retract, pulls on the rib cage, expands the rib cage recoils and compresses. Open, expand, close, compress. Open, expand, close, compress. Open, expand, close, compress. Back to the center, press down. So let's look at a few modifications. If the range of motion's limited, sometimes it's better to have the hands slightly forward instead of at the side. So I want to be able to open fully and keep that external rotation in the shoulder girdle. That limited range of motion might cause somebody to start to distort the movement if they're trying to get to the hands to the side. It might also cause pain. So if it's more comfortable and they're able to get the full opening by having the hands forward, that's a desirable. Then compress, everything else remains the same. So it's just a modification to find the range of motion. Maybe somebody can get their full range of motion with the hands slightly forward. Maybe that applies to you as you're doing this one, no problem. But over time, if you can start to work on increasing it, you might notice the hands go back a little bit. Rib cage can continue to expand. And you're shooting for the hands to go to the side, but wherever they get to, they get to. As long as you can increase it and get full volume and stretching and movement through the rib cage, that's what you're looking for. So open, chest expands, rib cage expands, close, and back to center. So often, as I have people practice this, I just have them breathe comfortably. The movement will dictate, that expansion might dictate how they breathe. And sometimes I think it's better, it's desirable to have people start with letting the movement and the timing influence the breathing instead of getting dogmatic about the breathing. However, you can start to combine the breathing, link the breathing to the move. And if I were to play with this or have patients play with that, I would have them inhale during the expansion phase. Exhale as it compresses. Inhale as everything opens, lifts, and expands. Exhale as everything drops and closes. Inhale, expand. Exhale, compress. The breathing should feel natural. If somebody's having a hard time, if that feels laborious, it doesn't feel connected, I sometimes don't think there's a lot of value in forcing the breath. They're using different muscles to do that. So it may be better for a while just to find the expansion, find the stretching, find the movement, let that pull on the rib cage, let that give the volume that they need for the proper breath. And then another day they can come back to the breathing. But when they're ready, or when you're ready, it's fairly straightforward to look for that inhale, lift, open, full volume, exhale, compress, drop, relax the shoulders. Inhale, expand, exhale, compress. Inhale, expand, exhale, compress. And press down. Final thing, we want to see if we can link the movement of the spine to the movement of the rib cage and chest. So we start to get that with the breathing, but as I open, everything gets taller, straightens in the spine, bow, compress, hollow in the spine. Chest lifts, I get taller, open, straighten, compress, hollow. So my abdominal muscles are involved in it. Things like the transverse abdominis that helps lift me, and the rectus abdominis that helps compress. Open, expand, compress, hollow. Open, expand, compress, hollow. Open, expand, compress, hollow. And back down. So we can practice together. Open, expand, compress, hollow. Keep it soft. Open, expand, compress, hollow. Open, expand, compress, hollow. Start to make it a bigger motion. Open, expand, compress, hollow. Open, pull the shoulder blades together, expand the chest, compress, hollow. Open, pull the shoulder blades together, expand the chest, the lower rib cage expands, compress, hollow. Let the movement work through the body. Open, expand, compress, hollow. Open, expand, big motion, compress, hollow. Open, expand, compress, hollow. So we'll start to make it smaller and lighter. Open, compress. We've stretched, we've opened things up, so we can take advantage of that and make everything soft and subtle. Soft, lift, open, compress, drop. Open, compress, soften, and drop. Back to the center. Press down.